and it's my pleasure to welcome you all here for a great conversation around mental health. For those who might not know Des Moines University, if you're in this town for some time, you probably may remember COMS or UOMS, the Osteopathic Medical School. We've been around 120 years. We've only been called Des Moines University since 1999. So whereas we may have a relatively new name, which really reflects where we are in the city of Des Moines, but we have a very engaged and noble history of excellence in the health sciences because we feel we really exist to improve lives in our global community by educating diverse groups of highly competent and compassionate health professionals. To partner with the Des Moines Register and others to bring this conversation to you today is something we feel very important for us as a health sciences university. And as a clinical psychologist myself, I have a personal interest in the topic that you will get to have good conversation about today, given the candidates giving their perspective on issues around mental health. With that, I'm going to move forward in the program because we really want to have enough time to hear from the candidates. It is my pleasure now to introduce Carol Hunter, who's the executive editor of the award-winning Des Moines Register, to the stage. Carol Hunter.
I join in welcoming you to this forum on mental health care, featuring the three major party candidates for governor. I thank the leaders of Des Moines University. You've been great in helping us stage this forum, and also for the Iowa Hospital Association for its sponsorship of the event. In the past few years, in interviews by Register reporters across the state, in editorial boards, and in the halls of the legislature, we've heard a growing chorus of criticism that the state's mental health services were in many cases failing Iowans. Our health reporter, Tony Lays, has written repeatedly about parents desperate to get help for their children, but finding no place to turn in Iowa. He's also told the stories of Iowans literally trapped for months in hospitals, or even worse, jails, because appropriate treatment options were not available. Last fall, we decided to step up our focus on these issues. Our opinion editor, Kathy Obradovich, was a friend of Sergei Neubauer, who committed suicide last fall at age 19 after suffering major depression, anxiety, and PTSD. For years, his parents had tried to get him the help he needed, but found Iowa didn't have adequate treatment options available. Kathy pledged to hold a forum and invite all the people who said that they were going to run for governor for the sole purposes of pinning them down on what they would do to improve mental health services in the state. The Register did just that, right here at Des Moines University last December, and 12 candidates appeared. Kathy said, well, let's do it again after the general election field is set, and that's why we're here today. The Register has also devoted a year-long series of special reports by Tony Lays examining what's working, what's not, and what can be improved with mental health services in Iowa. In fact, another installment will appear next Sunday, and that one's focused on dementia. You can read the entire series at DesMoinesRegister.com/mental health. The good news is that Iowa's elected officials are paying attention. The Iowa legislature passed significant legislation last spring to improve services, but there's so much more work to be done to ensure adequate funding for these services and to start from virtually ground zero in building an adequate system to serve our children. I thank each of the candidates for agreeing to be here today. It's just over 3 weeks until Election Day. Their time is very precious at this time of the election calendar. Their presence today signals important interest in this issue. I also thank each of you for being here. It's going to take your continued interest and advocacy to make progress on these issues and to truly ensure that Iowans can get the mental health services they need. Now let's get started. Kathy Obradovich, our opinion editor, will be moderating today's event.
Thank you. Thank you very much. I just want to add my thanks to each of you for being here, and also to the candidates, and also to my co-panelist here. Dr. Lisa Streffler is the chair of the Department of Behavioral Medicine, Medical Humanities, and Bioethics at Des Moines University. Prior to teaching, Dr. Streffler practiced as a psychologist in Des Moines, where she specialized in working with postpartum women, anxiety, and trauma. She completed a bachelor's degree at Harvard and her PhD at the University of Iowa. So let's thank Dr. Streffler. Okay, just a quick note about the format. Each candidate will come up in turn, speak for about 10 minutes on mental health and substance abuse, and then take questions from Dr. Streffler and myself. We will be collecting written questions from you on the topics of mental health. In fact, we already have a lot of great questions from you that you emailed in, so thank you for that. And if you have some questions now, just send them to the aisles. We'll keep picking them up after each candidate speaks. I'd also like to ask you just for a couple small favors. Please silence your cell phones right now. I know you all checked before you came in here. Just check again. I just checked mine. And I want you to give the candidates a warm welcome as they come to the stage and at the end of their time. But I'll ask you to please hold noise to a minimum so everyone can hear. We'd also like to encourage you to stay and hear all the candidates, but if you really need to leave, please do so quietly and in between speakers. So thank you for that. And our first candidate this afternoon is Iowa Governor Kim Reynolds, a Republican and Iowa's 43rd governor. She is a fifth-generation Iowan who grew up in St. Charles. She served as county treasurer and state senator before becoming lieutenant governor and now governor. She and her husband, first dude Kevin, have been married 36 years, have 3 daughters and 9 grandchildren. Governor Reynolds. 10? Oh, gosh. So there's your timer. So,
okay. We're up to 10, so I think that's maybe where we're going to end up. But we just had Reed joined us last Friday, so I want to thank the Des Moines Register, Dr. Franklin, Des Moines University. Thank you for hosting the forum, mental health forum, this afternoon. Mental health has been and will continue to be at the forefront of my administration. As I said in January in my condition of the state, no parent, child, friend, or neighbor should suffer in silence when it comes to mental health. And I firmly believe that statement. We know that addressing this issue is complex and it won't be solved overnight, but we are making progress. Since 2013, we've made great strides in improving Iowa's mental health care system. We redesigned our system to ensure that all Iowans have the same access to the same core services regardless of where they lived. It was a county-by-county delivery system, and we went to the regional system at that point. We expanded access to mental health care for 150,000 Iowans, and we've invested $4 million in new psychiatric medical residency programs that will help recruit and retain more psychiatrists. In fact, I recently had the opportunity to participate in the ribbon cutting for the new psychiatric residency program at Mercy. There were 4 residents that we were welcome, and they actually had over 1,000 doctors that have applied to participate in the residency program. They're now taking new applicants for next year's 4 residency spots, and they already had 700 that had applied, so that's really good news. And these are wonderful steps forward, but we all know that we can't stop now. We must do more, and we are. Since I was sworn in, I've worked closely with mental health experts, association leaders, mental health organizations, providers, and parents who have lost children to mental illness, and worked collectively with the Complex Needs Study Group. And these collaborations are leading to results. This spring, I signed significant mental health care bill that represents a strong step forward toward improving access and care for all Iowans. The landmark legislation includes access centers, assertive community treatment teams, comprehensive crisis services, and intensive residential service homes, and a 24/7 access hotline, to name a few. Multiple stakeholders are coming together to make recommendations that will ensure the system is sustainable for the long term. I'm really proud to say that that comprehensive piece of legislation passed unanimously and was proud to sign that into law. When I signed the mental health bill this spring, I also signed an executive order that created a Children's Mental Health Board that will focus specifically on our children. As I've said in the past, we must continue to identify the gaps in our state's mental health system, and the lack of a coordinated children's mental health system is a significant gap. Initially, the new Children's Mental Health Board will develop and recommend specific steps to build a children's mental health system. Then they will, after that is done, they'll provide oversight and technical assistance to the entire system as a state board. But my commitment to improving Iowa's mental health system didn't end there. We have the first in the nation public-private partnership with a $250,000 appropriation to partner with Des Moines University and NAMI for the Des Moines University Provider Education Project. That will provide primary care physicians with training and skills to recognize mental illness signs in Iowans. And DMU trains more primary docs than any other state in the country, and so that will help with access in rural Iowa as well. We expanded access to telemedicine, making it covered by commercial insurance. And this last legislative session, we gave schools more flexibility in their funding to support hiring of mental health counselors and school psychologists. All of these historic outcomes prove that incredible things happen when we all work together. In the meantime, there's a lot that can be happening. We can continue working together to promote mental health first aid, which is an innovative approach to providing youth-serving adults with the necessary training and skills to recognize early signs of mental illness. And this is critical in detecting mental health issues early, which leads to providing help and intervention efforts. The earlier that a young person struggling with mental illness is identified, and the sooner they access appropriate supports, and the greater the likelihood of a positive outcome. To quote the Substance Abuse Mental Health Services Administration, prevention works, treatment is effective, people recover. That means people of all ages in all four corners of our state. We must maintain our commitment to treating Iowans facing mental health challenges with compassion and dignity, again, so that no parent, child, friend, or neighbor suffers in silence when it comes to mental health. And together, I'm confident that we can continue to build on the progress that we're making. In my condition of the state, I also recognize the anguish caused by addiction to Iowans and their families, and acknowledge that with proper treatment and support, life can be so much better. I know that because I've been there, I've lived it, and my family has lived it. We know when Iowans seeking treatment, the four most common substances reported are alcohol, marijuana, methamphetamines, and opioids. The destruction behind these drugs is something I know many of you see every day. Unfortunately, the opioid epidemic sweeping our country is affecting every state, and Iowa is no exception. Each year, we continue to see the number of opioid-related overdoses and deaths continue to increase. We continue to read horrible stories from other states, and it's heart-wrenching. I've listened as other governors have described the devastating loss of life of the opioid epidemic. And fortunately, Iowa isn't at that point, and we never want to be there. And that's why I was proud to sign legislation that takes important steps to help combat the opioid epidemic. The legislation has three main goals: prevent doctor shopping, reduce overprescribing, and support Iowans suffering from addiction. And with the money that the federal government is investing to address the opioid epidemic, there is an additional $4.4 million that will go directly to funding medication-assisted treatment, and that's a vital and proven method of treating opioid addiction. But Iowa's problem isn't limited to just opioids. We've also seen requests for treatment for methamphetamine addiction double over a 5-year period. The need for effective prevention and treatment services is only growing. According to the 2015 National Survey on Drug Use and Health, 95.4% of those who needed substance use disorder treatment did not think that they needed treatment. So as we look for solutions to address the opioid epidemic and the methamphetamine use, we cannot forget to also address the stigma and its direct role in people not seeking the help that they need. We must reach out to those individuals in need, and we can break down barriers and challenge stigmas within our own organizations and wherever we see it. We can also make sure that Iowa's prevention and treatment services are the best that they can be. This year, I will be celebrating 18 years of sobriety, and I can tell you that I would not have been able to do it on my own without the support of a family, my community, and the services that I was afforded through PAL. So I do know that life can be better, and I do know that it's going to take all of us collectively working together to make that happen. Thank you.
Thank you, Governor. We are going to start with questions, and just so you know, Governor, we're not timing your answers. We've got 15 minutes, and we'll have some time cues when we're getting close to the end. I will just ask you, though, try to keep your answers kind of brief, because we have a lot of people who have asked some good questions.
Okay.
And we're going to start with Dr. Strepler, and I'm going to move my chair because I am looking over my shoulder at you. So, okay, go ahead.
Governor Reynolds, as you discussed in your opening remarks, last year you approved the plan for the much-needed expansion of mental health services in the state. However, no funding was allocated with that plan, and some of the new services are not being covered by privatized Medicaid. What will you do to provide funding for these expanded services?
Well, thank you for that question. Part of the legislation that we signed last year also put a working group together that will help answer that exact question on how we will be able to sustain and fund the comprehensive mental health care that we passed. And it will include the mental health regions. It will include all stakeholders that were part of the complex needs study group. We also were able, with the managed care contracts that we just renegotiated, they do include in the rates that we certified funding for some of the comprehensive mental health care reform that we passed last year. So that'll be a component going forward. That'll allow us to start to put in place some of the initiatives that we've started, and we'll continue to work with the mental health regions, the 15 regions. They have some funding there, especially when it comes to the access centers. And then the task force group is to report back to us, I think, January 15th with additional funding. That'll also include, though, some of the savings, that's not all of it, but if we get people out of the ER room and out of hospitals, get them into the access centers, get them stabilized, the treatment that they need, and then back home to their family and their communities with the assertive community teams in place to help them stay there. There will be some cost savings there, but that's some of the things that the workforce group is looking at. So we spend about $600 million right now. I think 2017, we spent about $600 million on mental health funding in the state of Iowa, and that's state and federal. So there is some funding there that we'll be able to shift over to the comprehensive mental health care reform that we passed last year.
If the task force recommends it and others have recommended it, would you support allowing counties to increase their levies to pay for expanded services? And would you support raising the sales tax to pay for both water quality and conservation, as well as expanded mental health services? Two ideas that have been raised.
And those are two ideas we're willing to look at, and I know that's what the work group is looking at, and that is some of the areas that they talked about last year for additional funding. So that's part of the mix. That's part of the conversation, and we'll wait to see what they report back. But this is important, and it passed unanimously. Every single legislator, Republican and Democrat, voted for comprehensive mental health care reform. And so I can tell you that the commitment is there to make sure that we can now implement the legislation that passed. And I hear that from both parties. There's a willingness to work there, and so I have all the confidence that we're going to figure out how to get this done.
Dr. Strepler, thank you. Last year you approved the sale of health benefit plans that are unregulated by state and federal insurance laws. These plans may, but do not have to cover mental health care, and the availability of these plans may increase the cost for insurance plans that must provide coverage for pre-existing mental health conditions. What do you plan to do to address that concern?
Well, so I was proud again to sign bipartisan legislation that passed last year to help provide affordable health care plans for Iowans that were, I mean, I heard it as I traveled the state. They were paying more for health care than they were for their mortgage. They had an extremely high deductible, and that was that so they weren't utilizing the insurance, or they were borrowing money in order to have health care coverage, and that just wasn't acceptable. I still think that Washington, D.C. needs to get something done with this, but in the interim, we couldn't just stand there and have not try to find a solution for Iowans that needed coverage. So both the association plan and the Farm Bureau plan are two health care options that passed with bipartisan support last year. They both have mental health coverage, so that is a part of it. They will provide it. And it was these are individuals who didn't qualify for the subsidies with Obamacare, and they couldn't afford the 57% increase. So that's what they were facing. So this is just an option, and it does have mental health coverage. And these individuals, not only would they have not potentially had insurance, but now they have insurance and they have access to mental health coverage as well. That's part of it.
And my understanding is that those plans would be allowed to deny coverage for pre-existing conditions. So if someone came in with depression or schizophrenia or a bipolar illness, that they would be allowed to deny coverage on that basis for mental health concerns?
Well, these are just an option. So there's still the other plans in place that people will be able to use. But there is underwriting, but once they're covered, it's an option. They wouldn't have had health insurance otherwise. So, and it passed bipartisan.
A couple of audience questions related to insurance. One, interestingly, this is the 10th anniversary of the Federal Mental Health Parity and Addiction Equity Act. The Kennedy Forum and Scattergood Foundation has provided a letter grade for each of 50 states based on the quality of their mental health parity statutes. Iowa got an F.
Yep.
So is there something that can be done about Iowa's mental health parity statute? And then secondly, insurance may pay for acute stabilization care in a hospital. Somebody has acute mental illness, but many of them don't pay for residential care in a setting outside of the hospital. So is there something that can be done to encourage insurers to help cover that? So two questions there, both related to insurance.
Yeah. Well, the first one, first of all, I don't think that there should be any difference between mental health and substance abuse treatment and other medical conditions. I think that they should be treated the same. And we spent a lot of this last legislative session addressing the stigma and the gaps that we found in the mental health redesign that we started in 2013. So we've made significant progress, and we're going to continue to work on parity issues that, that's just, again, a gap that we need to continue to work on so that we can make sure that those are covered, because I do believe that they should be.
Thank you.
Thank you. We got a number of questions about the mental health challenges faced by older Iowans. Mm-hmm. So issues of loneliness, depression, anxiety, perhaps that the elder Iowan does not want to admit or is embarrassed to access care. What would you do to see that the issues affecting our older population are adequately addressed for mental health care?
Mm-hmm. Well, access to psychiatrists and to physicians, the pilot program that we talked about with the Des Moines University and NAMI, I think training the primary care doctors to help identify early warning signs, I think is a step in the right direction, especially for access in rural Iowa. And we've said all along that it shouldn't matter on a lot of these initiatives where you live, whether you have access to those services. And so that's why, I think this is a step in the right direction, and it helps us identify some of that, because a lot of the primary doctors that graduate here are located in almost all of our 99 counties. And so that's an opportunity to help us maybe provide the outreach and identify some of those early warning signs with a physician that they feel comfortable with. And I think a lot of times then they'll feel more comfortable to sharing some of their concerns or some of their, so that's one thing that we would do. And then again, the psychiatric residency program that we've put in place, I'm really excited about that. That was a public-private partnership with Unity Point, Broadlawns, and Mercy. And that is going to go a long way in helping us, because we're dead last when it comes to psychiatrists, and we can do better than that. And that's why we put the program in place in 2016. It's a public-private partnership. And the response that we're seeing, I think, is really exciting. I said in my remarks, Mercy has 4 residents that they just brought on, and they'll do it over the next 4 years. And when we were doing the ribbon cutting at Mercy, the doctors in their comments had said that they'd had over 1,000 doctors or physicians apply for that residency, and they've had over 700 for the second 4 spots. So there's a lot of interest in that. And if they do their residency, the state that they do their residency in, they tend to stay in. So I think that's another positive sign that another positive sign to help provide access to psychiatrists.
Some questions from the audience about the accessibility of beds. The legislation that you signed did deal with access, especially to acute care, short-term emergency stabilization. But a need remains in the development of longer-term residential mental health treatment. It's not at the full hospitalization level. It's commonly called subacute care. Some mental health service providers say they're reluctant to develop those programs because there isn't reliable funding to pay for services here in Iowa. What can be done to change Iowa's funding structure to allow the development of these badly needed services?
For the subacute beds?
Yes.
Well, that was part of the mental health redesign form that we did. Because it wasn't really the beds that were the problem, because there were always open beds. It was just the type of bed. Mm-hmm. And so part of the legislation that we passed with the comprehensive mental health care reform lifted the cap on subacute beds, and so that we could get the individuals the services that they needed. And so that was part of the reform that was passed, and that'll go a long way, I think, Kathy, in helping address that concern. Also, the access centers will help with that. Again, it'll help get them the place that they need to be, help get them stabilized, back home with their family. And it will help, the other thing that we had is we had people being transported all across the state instead of being able to stay locally and in their communities. So that was not only taking law enforcement away from what they needed to be doing, but no individual should be transported clear across the state to find a type of bed that they needed. So by lifting the cap on subacute beds, that'll go a long way in addressing that concern and treat people where they need to be treated.
I wanted to say that I very much appreciate your sharing your personal story with alcohol. I think that goes a very long way in addressing stigma and making it more possible for people to talk about needs that they have. Related to that, it's estimated that only 13% of Iowans who need treatment for substance abuse get it. What will you do to expand availability of substance abuse treatment, and particularly to help pay for it for individuals who do not have insurance or do not have the ability to pay out of pocket?
Mm-hmm. So, what we need to continue to do, so sometimes they're so interrelated, mental health and addiction, and they go hand in hand. And so I think that it's important that we work really hard to put in place an integrated, coordinated healthcare system, and that's part of it. And I think the more that we're able to do that, we'll do better at being able to utilize the resources that we have to get people the treatment that they need. I was lucky. It is still a problem, and I know it's still a problem. And when people hit the bottom, that is when they need to get the help, because that's when they're at a place where they know, finally, that they can't do it on their own. And so it is so important that when we have somebody that's at that place in their addiction, that we have the facility or have the people that can work with them to help get them sober or to help them address the addiction. And so, I think the entire system that we're starting to put together will go a long way in helping do that. But again, it's critical, and I know that. It's critical, because sometimes you don't get a second chance.
Thank you. I wanted to address the issue of provider shortages in Iowa. There has been an ongoing shortage of psychiatric care providers, especially for children. Also, there's concern about providers being able to stay in business because of late payment from MCOs. We've got a question here from a provider at a small agency who says that they're owed several $1,000s by an MCO. So wrap your answer together into how do you encourage providers to come and work in Iowa. I know we're training more providers in various ways now. How do you get them to stay? And how do you get the existing providers to want to stay as well?
Well, the residency program is a step in the right direction because once they do the residency here, they tend to stay. It's a great state. It's a great place to live, work, and raise a family. With the providers, I will tell you, we've done several things since I was sworn in with managed care. And it started with bringing in new leadership. It started, then followed with a new actuary. We've put the amount of funding in the program that it needs. When we started managed care 2 years ago, we did it because the old system wasn't sustainable and we weren't going to be able to look families in the eyes and assure them that we would have a system there to take care of their loved ones once they were gone. And so like 39 other states have done, we transitioned to managed care 2 years ago. We transitioned and funded based on assumptions. And today, with the new actuary that we brought on, with the new leadership, we are fixing the system based on experience, 2 years of experience. So we now know what it costs to provide the services to some of our most vulnerable Iowans. And in the contract negotiations, we also put financial penalties in place for the managed care providers if they're not paying in a timely manner. I am not going to continue to travel around this state and have people tell me that are providing the services, the doctors, the providers, the nursing homes, that they're not getting paid for the services that they're providing Iowans. I'm not going to continue to do it. We put additional oversight in place last year, financial penalties. If I continue to hear this as I travel the state, we're going to up the ante.
Okay, Governor, thank you so much. That's our time for questions. Thank you very much for being here. And our next candidate is Fred Hubbell, and he is making his way up here. He is a lifelong Democrat, fifth-generation Iowan from Des Moines. He has run several large companies, including Yonkers Department Chain in the 1980s and Equitable of Iowa. In 2007, he led the Iowa Power Fund, and in 2009, he oversaw the Iowa Department of Economic Development. He and his wife, Charlotte, have 3 children and 3 grandchildren. Is that right? Okay, we were one short on the governor, so I wanted to make sure. Come on up. Thank you. Oh, one on the way. Okay, very good. So, Missy's your timekeeper. She'll tell you when you have a minute left for your remarks, and then we'll go to Q&A. Okay? All right, thanks.
Well, good afternoon, everybody.
Good afternoon.
You know, it's snowing outside now.
Oh.
That's the truth. It is. So we're all very glad to be in here. So, Kathy, thank you for the kind introduction. You know, I'm a fifth-generation Iowan, a lifelong Democrat, and I'm running to be the next governor of the state of Iowa. And we're here to... Thank you. But we're here today to discuss mental health and substance abuse. And I'm grateful to the Des Moines Register, Des Moines University, and the Iowa Hospital Association for holding a forum on such an important issue. In fact, the second forum on this issue. My wife Charlotte and I have worked for years to improve access to mental health care in Iowa. A few years ago, Broadlawns approached us and some other people because they had a growing shortage of beds and psychiatrists with no place for the people with mental health to go. Charlotte and I helped them expand their facilities to provide a 50% increase in mental health beds and add 2 new psychiatrists to better serve patients with mental health needs. Make no mistake, we face a serious mental health crisis in our state. And whether it's you, your family member, your friend, or a neighbor, everybody is affected by the lack of critical mental health services across Iowa. Senator Rita Hart, who I'm proud to call my running mate, and I have spent the last 18 months traveling across our state, listening and learning from people about the issues affecting Iowans most, including mental health. Last October, I traveled the state on a mental health tour, mostly visiting county jails and listening to law enforcement officials who told me how they basically have become the de facto catch-alls for those who are suffering from mental health issues. Rather than sitting in a jail cell, they need to get the care that they deserve. Law enforcement resources are stretched thin, and officers are now spending hours driving across the state to get people the mental health treatment that they need. In our rural communities like Harlan, Iowa, I heard about a serious mental health problems facing our farmers. Farmers have the highest suicide rate of any profession in the country. Due to the mental health stigma, they are often hesitant to seek help, and even if they do, they often can't find any local mental health services. A couple of weeks ago, I got a call from two terrified parents in Cedar Rapids. Their 12-year-old son was sleeping on a couch in an emergency room, waiting room bed, while he waited for a mental health bed to become available because there weren't any. That's not acceptable. So let's go back. How did we get to where we are today? For the last several years, the Branstad-Reynolds administration has systematically undermined and underfunded programs and facilities designed to help those who are battling a range of mental health issues. For the last 20 years, Iowa has been given either a D or F by the National Alliance for the Mentally Ill. The managed care disaster implemented by Governor Branstad and continued by Governor Reynolds has resulted in fewer Iowans receiving the care that they need. According to the Treatment Advocacy Center, in 2016, Iowa ranked dead last in the number of psychiatric treatment beds available per capita and 47th in the number of psychiatrists licensed to provide care. The Branstad-Reynolds decision to close the facilities at Clarinda and Mount Pleasant led to a dramatic decrease in the number of inpatient beds available to Iowans in crisis situations. And it placed significant new burdens on other healthcare facilities that are not equipped to provide the services those people desperately need. On our mental health tours, Rita and I have repeatedly heard from patients and local providers who cannot access the local mental health services that they need. Patients are refused care due to lack of available beds, available doctors, and have to drive hours to get treatment. The privatization of Medicaid is also negatively affecting mental health care. I met Cole in Iowa City. It's a young man struggling with mental health issues. He and his mom, Tammy, told me how Medicaid privatization has caused delays and denial of services that he needs. Mental health providers are struggling to keep their doors open due to delayed or denied payments from the private out-of-state managed care organizations. We can't ignore this problem any longer. Mental health issues impact people of all ages and all communities. Governor Reynolds will say she passed a great bipartisan bill on mental health, but to me, it's just a political Band-Aid. The bill was a step we can all agree on, but it provided no funding to local communities to deliver the care. Instead, it just burdened them with more unfunded mandates. Once again, the government of Iowa will be studying what needs to be done in the mental health field, when in reality, we already know. We must address the crisis by putting real funding behind this issue because this suffering is not acceptable. We also need to review the state's regional approach to mental health. When listening to Iowans, it's clear some regions work better than others. Some have too few resources. Others have a little more. But the overall system lacks accountability and consistency. An Iowa poll conducted in January this year found 73% of Iowa adults believe the state's mental health system is in crisis. Less than 2 months later, in March of 18, Governor Reynolds cut $4.3 million from Iowa's Department of Human Services. That's the department that manages our state's mental health system. These cuts compounded the problem as access to mental health care for thousands, particularly those living in rural communities, was already threatened. Governor Reynolds recently signed into law the new Farm Bureau health plan for Iowans. But critical mental health coverage is not included in that bill. and those plans do not cover pre-existing conditions, including mental health issues. Instead, we should be working with insurance providers to make sure that we actually have parity for mental and physical illnesses in our state. As governor, I will support. As governor, I will support the development of at least 50 to 75 high-intensity mental health beds across the state so we can truly provide the continuum of care that to help the people who best need all levels of service. As governor, I will also support expanding community-based care by investing in more training and funding for psychologists, social workers, and nurses. That will help Iowans address mental health issues before they reach a crisis point and before they need to access a state-level institution. Lack of community-based support and investment in prevention forces those in need of treatment into extremely costly emergency room visits or jails. It costs more than $30,000 annually to incarcerate a person in an Iowa prison. An average emergency room visit costs upwards of $1,000. Growing evidence is clear that by investing in community-based mental health facilities and diversion programs in our county jails, overall cost to the community can be substantially lowered. During my mental health tour to 8 of our county jails, I saw firsthand the role that our public safety officers and correction facilities are forced to play in caring for our mental health patients. Roughly half of the prison population in Iowa have mental health issues. 40% of the male inmates, 60% of the female inmates. By properly addressing mental illness through diversion programs and strong community-based treatment, we can save our jails hundreds of thousands of dollars by reducing recidivism. Last December, our campaign proposed a mental health plan the week before your first forum. That health plan suggests that we need to invest in local community-based providers, including diversion and substance abuse programs. We need to increase the number of long-term, high-intensity beds across our state, and we need to create Iowa's first youth mental health program. The fact that Iowa's going back to the drawing board for another study on children's mental health service delivery system means that we are ignoring what we've already studied and we already know. Increasing the availability of these services, particularly within our schools, increasing trained professionals, and providing appropriate funding will do much to improve care for youth. Mental health problems like depression and anxiety affect 1 in 5 children in our state today. There needs to be a public health response to children's mental illness before it reaches epidemic proportions. We need more counselors and mental health professionals in our schools. But unfortunately, our school counselors are being let go due to education budget cuts. And there are drastically low levels of children's mental health psychiatrists and nurses in our state. We need to encourage programs and partnerships with school districts for early identification, prevention, and treatment for children. We need to include pediatricians and family physicians in the mental health screening process to help early identification and treatment. But Iowa does have several programs that are working. They need more support. I met a gentleman in Davenport with mental health needs. He'd been to jail multiple times and always struggled with his illness. But this time he was lucky enough to end up in a mental health court, which focuses on rehabilitation instead of incarceration. And the mental health court helped him get back on his feet and eventually back into a full-time job. Unfortunately, this program is struggling due to lack of state funding. We also have the SafeNet RX program, which provides medications and medical supplies to those who can't afford it. It helps those with mental health needs keep on their medication and helps them with reducing recidivism. Many of us here today know that we don't need another study. What we need is leadership and real funding to help solve the problems. I look forward to answering your questions today. It's time to restore opportunities across our state. It's time to invest in people again in our state. And it's time to work across the aisle for the benefit of all Iowans. Thank you very much.
Okay, thank you. Okay, We have 15 minutes for Q&A. We're not going to time your answers. We'll just ask you to keep them short because there's a lot of people here who have asked questions. And we're going to start with Dr. Streffler.
In your remarks, a couple of times you mentioned the need for real funding for the changes to the mental health care system. Would you support allowing counties to increase their tax levies to pay for expanded services, or support raising the sales tax to pay both for water quality and conservation as well as expanded mental health services?
Well, first of all, I think if you're a financially responsible steward of state government, you have to look at where we're spending the money already in mental health. And as I said earlier, we're spending a lot of money supporting mental health individuals in our county jails and in the emergency rooms, which is the most expensive place for those people to be. So if we start focusing our attention on prevention, early identification and prevention, we can save a lot of money. Polk County, Johnson County, Story County have proved, I've seen the numbers, talking to those county, the people in the county jails there, that if we focus on jail diversion programs, crisis intervention training, mobile crisis centers, early identification and training, we can save a lot of money. So before we start raising other money, let's start providing a system that focuses on reducing the cost of providing the service that we're doing right now. Then we need to work with local communities to give them more flexibility, because not every community is the same. They all have different needs. They're all in a different position in terms of what kind of support and funding that they need. So let's let local communities figure out what they need for mental health services, and then we need to give them more flexibility. So if a local community determines in their county that they want to want to increase or change the levy, which goes back to it's being set at 1996 levels, then I think we need to look at giving communities that kind of flexibility. And I think it's important that we recognize that not every community is in the same situation, so let's allow that kind of flexibility. But at the same time, we need to stop what I have identified many times since 2009, wasteful corporate tax giveaways. That's about $100 million every year. There's money right there that if we stop handing out dollar bills and getting back coins in terms of state tax credits that are going mostly to big companies, we can use that to invest in people and healthcare and education. So we can put counselors in our schools. We can actually support jail diversion programs and mobile crisis units all across our state to help reduce the cost. So I'm not in favor of increasing the sales tax more than at all to support this, because I think there's plenty of other ways to improve what we're spending now and to stop spending unwisely in other areas and divert that money to this issue.
A little housekeeping before we go on. We're getting a big echo here with the mic, so if anybody from audio could maybe just check the levels. You're soldiering on despite that, so I appreciate that. You talked a little bit about state funding, but what about the responsibility of private insurance companies? I asked a question a little earlier about the fact that this is Iowa's mental health law has been on the books for 10 years, but the state is receiving an F for mental health parity. And insurance companies might pay for short-term acute hospitalization for mental health care, but a lot of times they won't pay for longer-term residential treatment. How can you encourage insurance companies to be a better partner for Iowa?
Well, what you described is going on all across our state. You know, when we outsource Medicaid, and by the way, 70% of the people who have mental health are on Medicaid, so in either place we're talking about the same people. When we outsource those activities to for-profit based companies, their responsibility is to make money for their business. That's their job. It's not to provide the best care to our Iowa citizens who need that kind of care and support. So we need to reverse the privatization of Medicaid, because besides having the wrong people provide the services, they are doing exactly what you described. In many cases, they're getting people out of treatment much faster than they need to be. And 30, 60 days, they're back in treatment again. And the managed care organizations make money either way. So they don't really care about that. So I want to stop the Medicaid privatization program and put the state in control, and have the state, when they have that control, make sure that we're focusing on prevention and continuum of care, so we're not arbitrarily getting people who need 30, 60, 90 days of service put back in society, if you will, after 20 days, or if somebody needs a year's worth of service, putting them back in society after 60 days. Because we know that all that's going to do is put them back in the treatment center again. So that's why we need to have the state take control of the Medicaid privatization process so we can get the right incentives to focus on quality of outcome.
Just to be clear, I wanted to direct you to private insurance, so employer provided. For example, the insurance that state employees receive for their families, they might pay for short-term hospitalization, but they're not going to pay for long-term residential care. Is there something you would be willing to do or could do to change that?
Well, that's why I said earlier that we need to focus on trying to get parity from our insurance companies as it relates to mental illness and physical illness, because we don't have that today in many cases, because what you're describing does in fact happen. And I think our state insurance department, no insurance carrier gets to do business in our state unless they're authorized by the state insurance department. So we have some opportunity to get involved in that decision making, and we should be starting to influence that process. If you want to sell insurance in our state for health insurance, then let's start recognizing how we're going to take better care of our people with parity and with the kind of support and service and the length of time that it takes.
Go ahead and ask what you want to ask.
You mentioned a couple of times the importance of prevention, and I wanted to ask a little bit more about that, specifically with regard to children. So we know that children's exposure to adverse childhood events like abuse, neglect, or witnessing parental violence has lifelong negative impacts on their physical and emotional health that have been well documented. What steps do you plan to take in order to improve the safety and welfare of children in our state, and how would you fund those steps?
Well, it starts with recognizing that we don't have a youth-based health program today in our state. So there's a lot to do. And it starts with commitment and leadership and a desire to get results and action, not studies. So just an example. What we need to be doing is if we properly fund our educational system, then we can have counselors in our schools. We can have more health professionals and nurses available in our schools, because now they're being cut out of our schools. And the teachers don't have the training, and nor should they have the training to take care of those issues. They're there to teach and educate our kids, not provide health services. But we need to. So it starts with properly funding our schools. Then we need to recognize that, as I mentioned, we need to get the health professionals that are in our community already, just the regular pediatricians and other people who work with young families. Let's make sure that whether they go to DMU or whether they go to University of Iowa or they come here, let's make sure they have some training, some helping to recognize and find out early where there are mental health issues or potential issues, so they can refer those children to somebody who's an expert in that field. You know, we need to approach this on a holistic basis for a whole community and recognize that the biggest incidence of mental health in our state is in elementary school today. Elementary school. I visited with 2 teachers the other day who teach in elementary school. They said in the last 4 years, the rate of behavior disorder in their classrooms is just going like this, just straight up. That's because we're not recognizing and we're not really allowing ourselves to admit it's a problem and it needs to be dealt with. So that's why we need to get all the healthcare professionals involved. We need to get parents involved. We need to invest in our schools so we have people there. And we need to make sure that the youth-based mental health issues are covered properly by insurance, both private as well as by our Medicaid state program.
This question from the audience, and I'm going to just expand on it a little bit. Most people don't seek or receive treatment for mental illness unless it becomes too acute to ignore. As we heard earlier, that also goes for substance abuse problems. Many reasons for this, although the stigma and overall lack of understanding associated with mental illness still seems to be one of the biggest barriers, even despite access to resources. So what specifically are your plans to bridge the gap between the stigma surrounding mental illness and access to the resources available?
Well, you know, when I was in Harlan, Iowa, the psychiatrist there that we talked to, who's a very well-known psychiatrist on mental health issues around the country, happens to do his practice in Harlan, Iowa. He described exactly that same situation. They have a local healthcare provider that does provide some mental health services. The local people are afraid to drive their car to park in that parking lot because they don't want because everybody knows everybody else's license plate, and they don't want people to know that's where they went. So we have a stigma in our state, not just in rural Iowa. It starts with recognizing that mental health is no different than physical health. When you have an issue, it needs to be accepted and addressed and dealt with effectively. That's why parity is so important, and that's why we need to do everything we can from leadership on down to recognize that there should be no stigma around mental health. It's no different than some kind of cancer. You can't see it, but it's real, and it needs to be addressed. It needs to be taken care of. And that's how we need to talk about it. That's how we need to address it. That's how we need to teach it in our medical schools. And that's the kind of leadership that we need to bring to our state and our school counselors and our parents and everybody involved in our schools as well as our health system.
Great. We have time for a couple more questions. Go ahead, Dr. Strickler.
So you'd mentioned the issues around care for substance abuse disorders, and there are a variety of holes in that system, but one that we were asked specifically about. Iowa is lacking enough well-staffed, well-trained, and easily accessible detoxification centers where those with an opioid substance use disorder can go to begin their treatment and safely withdraw from the substances they were using. How could you, as the governor of Iowa, address this and improve treatment and access for this specific service in our state?
Well, that's a very pertinent question, because what most people don't really realize is that substance abuse goes to Department of Public Health in our state. Mental health goes to Department of Human Services. And they're separate entities. They don't necessarily work together or collaborate. And so I've traveled to a lot of communities where mental health providers are doing what they need to do, but it's a co-occurring situation oftentimes, at least half the time. So they also have substance abuse issues. And they don't necessarily have the training or support to take care of that. And substance abuse doesn't have the kind of funding that it needs to provide the services in our state. In many cases, there's nobody to refer them to in terms of substance abuse provider. So it's a real challenge. So we need to look at that issue, and we need to be willing to look at more flexible, creative, structural changes. Maybe we should be figuring out how we can work on those illnesses together rather than separately. Maybe we need to make sure that the funding is together, not separate.
I wanted a number of questions had come about older patients and a variety of mental illnesses that they suffer, including anxiety, loneliness, depression, and also dementia. And experts do say it's increasingly hard to find nursing home placements for frail patients who have aggression caused by dementia or mental illness. Should Iowa create a special nursing home program for such patients, or what are your ideas?
Well, let's go back to Medicaid. I've met with a lot of Medicaid providers around our state. Many of them run senior care centers of one form or another. And they'll tell you that they can't afford those people because they get paid so little in terms of reimbursement from our managed care organizations that they lose so much money on them, they can't afford to have too many of those folks in their nursing homes. So it's a serious problem. But it goes back to the fact that we never should have outsourced Medicaid privatization to out-of-state companies. Let's put the state back in control, and let's focus on the quality outcome that each different group of people in Medicaid need. Part of it is cost, but each group needs a different focus on what the quality outcome is for them. And senior citizens need a different quality of outcome than people who are in Medicaid for economic reasons or people who are LTSS population. They need to be treated differently, and they need to have their quality of outcome defined properly.
We have just time for a very short question, but you had talked a little bit about criminal justice, jail diversion. And here's a question from the audience, how does addressing mental health issues affect the criminal justice system, and what changes would you make to stop criminalizing mental illness?
Well, that's a very good issue. I mean, let's not stigmatize mental health individuals and say that they're the ones causing all the crime out there or all the serious crime. It's just not true, folks. So it starts with not creating more stereotypes and more stigmas. Crime is created by all kinds of different people for all kinds of different reasons. So what do we want to do? I've been to Polk County Sheriff's, the jail. I've been to 7 other jails in our state. Some are doing a really good job. Some would like to do a lot better. The ones that are doing a good job have already had crisis intervention training for all of their police officers, particularly the ones on the street. They have mobile crisis units. So when somebody has a crisis out there somewhere in the community and it's not really a serious crime, they call the mobile crisis unit because they can identify it. They've had the training to identify what's going on. They call the mobile crisis unit. They come out and figure out, okay, where do we send this person? Emergency room, jail, or to a local community-based treatment facility. And those communities that have that training and those tools are saving a lot of money in their criminal justice system. But those that don't are not. I was talking the other day to the sheriff down in Des Moines County. He's right next to Fort Madison and right next to Mount Pleasant, where 2 mental health facilities have been closed. He says that since they've been closed, he's had a 50% increase in people in his jail on an average basis. And most of those people have mental health issues. 50% increase since we closed those facilities. Now, he's doing the best that he can, but when they show up in his jail, they've not had any kind of community-based treatment. In the prisons, they're not getting hardly any kind of support. So if we want to help people that have mental health issues or substance abuse issues, if we address those issues more effectively, we can reduce crime rates. We can reduce the number of people that are in our jails and in our prisons. That's the approach that we need to take: prevention, identification, and support.
Okay. Thank you very much, Mr. Hubbell. Thank you very much for being here. Thank you. Thank you very much. And our next, last but not least, our next candidate is Libertarian candidate Jake Porter, and I see him coming up here. He is a business consultant from Council Bluffs. His company uses technology to cut costs and improve efficiency to clients. He was the 2010 and 2014 Libertarian nominee for Iowa Secretary of State. Mr. Porter also served as alternative representative to the Libertarian National Committee for 2008 and 2010, and is a former employee of Yahoo. Jake Porter. Thank you. Thanks. Missy's in the front row. She's your timer. She'll let you know when there's a minute left, and then we'll go to Q&A.
Well, I talk pretty fast, so hopefully.
Okay.
No, I think I brought the snow with me. I was over in Council Bluffs before I came over. There was about an inch of snow on the car, and I was looking, where's my ice scraper at? Well, I don't have it, so I go over there, and the first thing I do is I think, well, I've got an old campaign sign here in the back that's halfway beat up, so I took that sign and I'm hoping that the neighbor kids did not get a video of that, so it'll be a viral video on YouTube. Maybe it'll help out the campaign and help the poll numbers a little bit more. I want to thank the Des Moines Register and the Des Moines University for having me and putting on this forum and talking about such very important subjects. You know, mental health and substance abuse. They're issues that have been ignored for far too long, that we've kind of hidden. And I'm happy to see that they're finally at least coming out in the public, that people are talking about these very important issues. You know, the suicide rates are soaring. Overdoses are occurring left and right, and it's something that does need to be addressed. Now, I want everyone to keep in mind something as they listen here. Last year, we had a gubernatorial forum. There was, I think, 12 candidates for governor up here talking. And one of the candidates, Dr. Andy McGuire, said something I thought that was really important. She said, if somebody walked through these doors and they had a broken arm or a broken leg, we would rush over to help them, right? What happens if somebody has a mental illness? What happens if they're suicidal, depressed? Are we going to know what warning signs to look for? Are we going to ignore it? What happens if they're a drug addict? Or are we going to go over there and help? And I think a lot of it's even knowing that there's a problem. A lot of times these issues are concealed. And that's the way it was for me. Now, a lot of the issues that, as I travel across Iowa and I get asked about, we discover they're really tied together. Whether it be the budget, prioritizing things in the budget, that's very important. Medicaid privatization, that's something that comes up. Criminal justice reform, mental health, the mental health facilities closing, all these things are tied together in some way. And so it's very important that whenever the Iowa poll came out, a lot of these issues you discover that they are very well related. I'm going to talk a little bit more generally here, and we'll get more into policy as we go through the Q&A. And I'm going to stay solution-focused. I'm not going to talk bad about any of my opponents or anything that they've done or said or disagree in that way, because I think we all must work together. I think there's a time for working together. And I really want to thank Fred and Kim for being here. I think that's important. You know, all three of us have went through things in our lives that we've had to overcome to be able to speak here today, that's for sure. There are three key points, though, that I want to hit upon: suicide, addiction, and bullying. So last year when we had the gubernatorial forum, I admitted something I had only told 5 to 10 people about properly. The question came up, I think it was Kathy that asked, what's the one thing, the most important thing it comes to address for mental health? And fortunately, I wasn't the first candidate, so I had a little bit of time to think. You know, 12 candidates, I had time, I was in the middle. And the more I thought about this, I thought, what was the thing that could have helped me the most? And I decided, you know, it's really the stigma surrounding mental health. The stigma surrounding any of these issues is the most important thing, that until we get past that, we cannot really, if we don't even know there's a problem, how can we solve it? If we're not willing to admit there's a problem, how can we solve it? So I made an admission, you know, back in 2011, I contemplated suicide. You know, looking back at it, the issues that I was having at the time, they seemed disastrous, like it was the end, like there was no hope. Looking back on it, it seemed minor problems. But at the time, they were very real, very important, something that really caused me a lot of problem to the point that I was going to kill myself. I went for a drive. I had made my last calls, you know, that I was going to make to my family, friends, people I cared about. They didn't know it was my last calls. And I went for that drive, and my next question was, how am I going to do this? Going to use a gun? Am I going to make it look like an accident? Am I going to take an overdose? How am I going to do it? Somewhere on that drive, fortunately it was a long enough drive, that just in a glimpse I had this spiritual experience, and I decided not to kill myself. Unfortunately, there's a lot of people that don't have that, and they end up going forward with it. And that's why I share that, because I think that we have to be able to share these stories, even though they're not comfortable, even though we don't want to, even though they aren't stuff we like to talk about. There's stuff that everyone goes through. You know, former Iowa Governor Hughes went through very similar circumstances that he wrote about in a book that I think inspired a lot of people. And it was reading his book that helped me come forward with my story. There's also things of stigma that, no, I haven't suffered with directly, but I know people that have. And one of those things is drug abuse. We need to end the stigma surrounding drug and alcohol addiction, illegal and legal drug addiction. We need to look at treating more of these issues as mental health issues, public health issues, and less as criminal issues. We have people that are afraid of seeking help in this state. They're afraid that if they admit they've got an addiction, their kids might be taken away from them. They might lose their job. They might lose their economic opportunities for the rest of their lives. They might even go to jail. These are the very real questions that people have to ask. And we have treated these issues as solely a criminal issue, and I think it's done a real disservice to the people that have those addictions. It is, you know, as Fred pointed out, it costs, I think it was $32,000 a year. He said $30,000, I don't know, to put somebody in jail or prison per year in Iowa. It's a lot cheaper to treat the addiction and substance abuse issue than what it is to put somebody in jail. Putting people in jail for these crimes whenever maybe we don't have to tears apart families. It leads to long-term consequences for society. And I would like to see us not look at a drug addict and say you're necessarily a bad person, that maybe you've experienced stuff that other people, that no one should have to experience in life. And that we should look at them with the same dignity and respect that we would like to be looked with. And then the last point I wanted to get was into bullying. Let's not insult others. Let's not make fun of people who do suffer from these issues. Let's not do that. And I think politicians can definitely learn from this right here, myself included. You know, it was Rumi, the Sufi mystic, that once said, yesterday I was clever, so I tried to change the world. Today I am wise, I am changing myself. I'm not always wise, I'll admit that, but I'm going to try to be wise today. We need to set a good example. Whenever you turn on the TV, this is one of the reasons why I got rid of the TV, what do you see, though? You see negative attack ads, people attacking one another. You turn on the news, it's all opinion. No one willing to work together, no one willing to address the issues. It's all back and forth, partisan BS that doesn't resolve anything. We may not always agree on the solutions. We may not always agree on the solutions. That's okay, but we have to extend and work with other people. And I find one of the most hypocritical things, we've got politicians telling children not to bully. We're going to pass legislation against bullying, and what do? They bully one another. That's not good leadership. And so, there's times that I get angry and I say things when I shouldn't. Like over the debate access, I think, Kathy, we probably went back and forth on that a little bit off and on, but that's not good leadership, though, for me doing that. And we need to admit that, and we need to work together with people, even when we don't necessarily see eye to eye. And so that is what I wanted to say, and I'm happy to get right into questions and answers.
All right. Thank you very much. We have a lot of good questions. Go ahead, Dr. Streffler.
So I'll ask you this question as well. So last year, the legislature and governor approved a plan for a much-needed expansion of mental health services in the state. However, no funding was allocated to support those new services, and some of them are not being covered by privatized Medicaid. What will you do to fund those expanded services?
That's a great question. One, if you're going to pass something, you have to fund it. I mean, I can think of several examples of this, too. We think about the constitutional amendment years ago, and I know not related to mental health, the constitutional amendment with the water quality environment. Well, that still hasn't been funded 8 years later. Legislation, whenever you pass it, you have to actually pass the funding. So we need to look at everything in the budget, actually work with everyone. I think one thing that we have not done in the state is we have Democrats and Republicans kind of fighting amongst each other, and we're not working together on prioritizing the things that everyone wants in the budget. That's something that the governor should not act as a dictator, so I don't think the governor should take over, Medicaid and privatize it overnight without any input from the stakeholders. That includes people on these Medicaid plans, that includes members of the legislature, that includes doctors. People are going to be impacted by this. Whenever we see government take action overnight, we tend to see consequences that we didn't quite figure were going to be there that show up. So I think we have to prioritize everything in the budget. Of course, the governor sets a recommended budget. I think we should take back the privatized Medicaid under the state system and then work for solutions to make it better. Involve all the stakeholders this time, and make sure we get it right. No one's going to get everything they want. That's part of politics, that's part of life, but we want a system that's going to help all of Iowans, or the most Iowans that we possibly can.
Just to be clear, are you saying that you would support raising the sales tax more than the 3/8 penny for water quality and include money for mental health?
Well, I think the question you'd asked before some of the other two candidates was the local option taxes as well.
Yes, and I've also, and that was the next question on the list. Would you also consider letting the local governments raise their property tax levies in order to fund the services in their regions?
So yes, I would. I'm not particularly a fan of the sales tax. I think the sales tax is a tax on the poorest Iowans. If you look at how many by income levels, who pays the highest percent of their income in taxes, it is the poorest Iowans, and that's the sales tax primarily impacts the poorest Iowans. So I'm not a huge fan of increasing the sales tax for anything, because that leads to other economic issues that I think we have to take into consideration. Now, that being said, I'm not going to tell the local government how they can collect taxes. Each community is different. So whether it comes to things like minimum wage or sales tax, trying to tell someone, a local community, what they're going to do statewide, I think ignores the economic realities of rural versus urban Iowa, and I don't want to do that.
Okay, Dr. Streffler.
So last year, the legislature and governor approved the sale of health benefit plans that are unregulated by state and federal insurance laws. These plans may, but do not have to cover mental health care, and the availability of these plans may increase the cost for insurance plans that must provide coverage for pre-existing mental health conditions. What would you plan to do to address this issue?
There's a few things that we can try to do and try to work in negotiations, but I'm going to be honest with you, and something that politicians don't like to say. Healthcare is a problem nationwide. It is a problem that if anyone running for governor of Iowa tells you they're going to magically fix healthcare, they are lying to you. So I'm not going to make any promises about what we can do in that. I see some problems when you have, whether it be with private Medicaid or you get the insurance that is negotiated through the state. A lot of these companies have a monopoly. Some of them do. And when they can give large financial contributions to the candidates negotiating their contracts, like $30,000 to a former governor who negotiates with Blue Cross, I see real problems with some of this stuff. So it changes that. But as far as fixing health care, I'm just going to be honest with you, I don't think the governor's going to get that accomplished. I think it's something you're going to have to change Congress.
You mentioned criminal justice reform, and we've had a couple of questions about this today. Here's one that I haven't asked yet. Please help me to understand your understanding of the school-to-prison pipeline. School-to-prison pipeline. What would be your plans to address this epidemic in our community and state?
This is one where we really need to work, I think, with the local communities. And I'm going to be honest, I don't know everything about any of these issues. And that's why we need to appoint, I think, more African Americans for one. I think that would be a good start. I think we also need to appoint more people at the local communities, and we can see exactly where problems are happening. You've got issues that when you have a lot of police in the school, that it creates that to where there's already a conflict, that they're looking for kids that are doing something wrong. And it just creates that almost that expectation that's going to happen, that they are doing something wrong. And I think it has impacted a lot of people.
Go ahead.
So I very much appreciated in your remarks, both now and at the previous forum, that you'd mentioned your own personal struggles with considering suicide. And again, I think that your willingness to share that really helps to reduce stigma and make it more acceptable for people to talk about these things. We had a question from an audience member. Most people don't seek or receive treatment until their illness becomes too acute to ignore. There are many reasons for this, but stigma and overall lack of understanding associated with mental illness still seems to be the biggest barrier among them. What specifically are your plans to bridge the gap between the stigma surrounding mental illness and access to the resources available?
I think one of the best things that I can do is to go around and speak to people and tell people about my story and to encourage other people to tell people about their stories. There are certain things the governor has the power to do, and that's one is going and talking to high schools, talking to young students early on to make sure that if they are suffering, that they know that there's nothing wrong with you, that it's okay to get help. There's also, when it comes to criminal justice reform, making sure that we aren't prosecuting people addicts for victimless crimes and instead treating the addiction. Obviously, if you harm somebody else, that's another issue. But just because you're addicted to a drug, I think there's better methods to get them help rather than using the criminal system and putting people in prison.
As has been mentioned, Iowa lacks any sort of mental health process or infrastructure for children. Question from the audience. I work with youth with varying severe mental health diagnoses. I have watched youth in critical condition wait up to 6 to 8 months for a PMIC placement despite a court order. There's only 40 inpatient PMIC beds, PMIC beds, in the state of Iowa. What are your plans to fix this?
I want to go back to the mental health facilities in 2015 whenever they closed. Whenever we have government taking action overnight without the involvement of stakeholders, this creates problems. This has created problems with that. It has created a burden on the county governments that now have to transport people further distances. Now when we're going to pass things that we're going to open up new opportunities or new locations here, we need to work with nonprofits, I think, but we also need to make sure they're opened up, strategically located, that we involve all the stakeholders, we involve local communities and determine where these locations need to be. Now we need to prioritize things in our budget. And I think as Fred pointed out, the state does give a lot of money away in corporate welfare. That's money that if we quit giving away in corporate welfare through things like the research activities tax credit, we would have more money to fund items such as these.
So another question from the audience. My family has tried to help my daughter by utilizing the committal process. The length of time allowed by Iowa law is not adequate to assist those with substance abuse problems. Is this something you would favor evaluating, and what could be done about this issue?
I think it's something that I'd definitely be interested in learning more about and working with members of the legislature to see about revising the current laws.
Okay. We have talked some today about the shortage of providers here in Iowa. question from the audience. We often hear about the lack of psychiatrists in Iowa, but as a social worker, I know that social workers and other related professionals make up the bulk of the workforce providing mental health care. What do you think Iowa's workforce needs most when it comes to mental health providers? What will you do to address that?
I think it's also strengthening rural Iowa, making sure that we have people in all locations, not just the cities, but also the rural locations as well, making sure that they're able to get people the help that they need no matter where you live. We look at things like Chapter 20, I think, that had a negative impact from what I've been talking to people. I also had toured with Passageway Mental Health, and they had told me about the issues they were having after the privatized Medicaid, the issues they were having after that. So I think that's something we definitely need to look at.
Through privatized Medicaid, which one of the big problems was not getting paid on time, so that would be one way to address it. And that deals with being able to keep providers here, but also providers who are being trained in the state aren't staying. That happens. It's a brain drain. It happens with a lot of different professions. Is there something that you would do to specifically address that issue?
Well, and I don't think the governor can magically fix all these problems without the help of the legislature and without the help of nonprofits and people in the local communities. I do think there are certain things that we can do to make sure that we do improve our economy, we make Iowa a better place to live. That way people want to stay here, and I think that's something that we can do.
So a broader question about substance abuse. It's estimated that only 13% of Iowans who need treatment for substance abuse disorders get it. What would you do to expand availability of substance abuse treatment and to help pay for it for individuals who do not have insurance or the ability to pay out of pocket?
I think this is one area that we need to, first of all, address the stigma, because there's so much stigma surrounding it that a lot of people aren't going to donate money to help with this. They're not going to help form nonprofits to help with this as well. And that if we diverted some funds over into actual treatment as opposed to putting people in prison, and we made that as part of the sentence, I think that would be a lot better than actually using it as just a criminal sentence, that we use some of the funds that we have right now there, that we're able to divert that into creating facilities. That way people can get help.
I want to make sure to ask you about treatment and options for elderly who are suffering from a variety of mental illnesses. And it might include loneliness, depression, anxiety, but also dementia. And it's hard to find nursing home placements for frail patients who have aggression caused by dementia and mental illness. Do you think Iowa should create a special nursing home program for patients like that, or what would you suggest?
It's possible that we should look within the legislature, and if they want to prioritize that in the funding, that we would include that in with mental health, and I would be more than happy to support that. But for the governor to act unilaterally in any of this without going to the legislature, I think would be dangerous. So that all has to be something that we're going to prioritize.
Okay, thank you.
Specific question about schools. The recommended staffing to student ratio for school counselors is 1 counselor for every 250 students. But at the mental health listening posts occurring in Iowa this month, school counselors were reporting that they commonly serve 650 students at a time, leaving them unable to actually provide counseling services. What could be done so that schools have the budget and the ability to have adequate staffing levels for student counselors?
This is one where we go through the budget, we prioritize the things in there, and we give more money back to the schools. That way they can have this. So we end corporate welfare, we end things like that, and we increase funding for things like this that are needed.
You mentioned, and I think the audience appreciated the idea that reaching across aisles and having the parties work together on issues like mental health. Interesting question from the audience. What's one idea from another candidate that you would support if you are elected in November in regards to mental health or behavioral health?
Well, one thing that I did was listening to Fred speak last year when he talked about where we could locate some of the mental health facilities at. I think he had some really good plans with that, so I would be happy to adopt many of his ideas. The idea is that you can't just open back up the facilities that we had before, but we need to take a look at it and strategically open up more facilities where they're going to make the most sense. That's something I would like to see happen.
Question about the extent to which you would favor state regulation of specific issues. So, for example, private insurance companies make a determination about what they will and won't cover in their benefits in negotiation with employers. So insurance companies typically will pay for acute hospitalization care in a hospital for mental health concerns, but many of them do not or will not pay for residential care in a setting outside of the hospital, so subacute care. What would you favor doing to encourage insurers to pay for subacute care in settings outside of the hospital?
One of the problems is we don't have very many private insurance companies left in Iowa, so there's no competition at all. They're able to come in here and dictate to us basically what they do. And until that gets resolved, I don't think we're going to solve that issue.
What would you do to encourage a more competitive, broader insurance market in the state?
Well, I think you could open it up to things like short-term medical. I think that would be good, getting that brought back. But this is a problem with the federal government all the way down, and I don't think that we're going to solve that. And I also find, a lot of these plans are negotiated with Blue Cross to the state employees as well, and they're giving large financial contributions to the people that negotiate their contract. I think we should end that for one.
Another issue with private insurance is that Iowa's mental health parity law, which has been on the books now for a decade, it's either not being enforced or it is not adequate to ensure that you cover mental illness the same that you would cover physical illness. Is there something that you could do about that?
It should cover mental illness just as it does physical illness, because they're both very related. They're similar things. People are suffering from it. People are dying because they have mental illness, and so it should cover that.
All right. Thank you very much, Jake Porter.
Thank you so much.
Thank you. Thank you. Thanks very much to all of you for being here. Your presence here, I hope, impressed on the candidates how important people of Iowa think this subject is. And I hope that you will make sure to register and vote on November 6th. And thanks to Dr. Streffler and all the candidates for being here as well.